All right, so let's start with Dr. Sanoga.
All right, so my name is Dr. Joanne Senoga, and I'm currently in Chicago, Illinois. And I am an IDPH consultant, and what I do is infection prevention, especially during the pandemic. I have a PhD in public health and epidemiology and a master's in public health, and have been able to sort of use that in the interim of not matching, and sort of finding alternative ways of staying in the field, especially if you're a medical graduate, so that you get credible ways is one of the reasons I truly was inspired to join this team.
All right, thank you. And then we'll go on to Dr. Sainval. Hi, you're muted.
Yes, I was. Okay, sorry about that. Hi, everyone. My name is Dr. Wedlin Sainval. It's Haitian or French for Wedlin Sainval. I am excited to be here this afternoon. It's evening. It's 7 o'clock in Austin. Um, I am a graduate of the IAU College of Medicine, IAU College of Medicine, which is International American University. I graduated in 2020. I did enter the match in 2020, and I did not get a spot. So I had a few things to fall on. In between medical school, I took a gap year, and I obtained an MBA and PH as well, and then came back and took step two. And this came up in some interviews, and I don't know exactly why I did not match, but it happens. Right now, I do have several years of experience in healthcare consulting. I have helped several practices in Atlanta launching their practice. Doctors launch their practice. It's been it's a great experience. And one of my goals when I get matched, I decided, you know what, I have something to fall on. Let me take this opportunity to really explore this avenue. So I decided to apply for a corporate position at WellMed, and that's where I am. They eventually moved me from Atlanta to Austin. That's where I am right now. And it's a tremendous opportunity for me to advance my career goal in healthcare management and leadership. And do I have plan to reapply for the match? Not in the next 2 to 3 years, because right now, I'm currently being trained in leadership to one day become a leader in either the VA or FQHC. That's where I am right now. I'm glad to be here to share my experience with all of you.
Okay, great, thank you. So my name is Henna Sawhney, as most of you know. I am one of the co-founders of American Society of Physicians. We started out with 9 unmatched physicians that co-founded this organization, and now several of us have matched, but several have actually decided to pursue other careers that don't necessitate going into residency and getting a license and working in that aspect of medicine. So the purpose and goal of this webinar today is to show the many opportunities there are for those of you that are pursuing non-clinical careers, whether it is as a stepping stone or intermediary until you get into residency, or something that you may actually have a passion for and really like and continue to pursue and forego getting into residency completely. Both ways are great pathways. This whole thing is about having a choice and getting back the autonomy to see what you can do with your medical degree and get a career. So as you see with Dr. Sanoga and Dr. Sainval, they've both pursued multiple degrees in addition to their MD and are utilizing their experiences together. So going off of that, and either of you can start, why did you choose your specific degree? whether it's the MBA or MPH, in addition to the MD, and how has that facilitated you getting moving forward within your field currently?
So I could start. Thank you. So it's very interesting. Actually, it was never something I planned to do, and so it's a very interesting journey. I did my master's in public health online because of my med school, the way it was structured. It was structured in a way we did not get federal aid. So I sort of had to sort of use this online refund to fund my med school. So it was sort of like a struggle, right? A struggle that sort of like evolved into something great. So when the pandemic started, I was almost finishing my PhD, but I really wanted to match, and I didn't think a PhD was that great. But then it happened, and that kind of like threw me off a little bit because I wasn't concentrating on residency, and it did not make sense to do residency in public health, especially if you're doing more of administrative work. There was no need, and even the experiences I had, interim, like I was doing infection prevention at hospitals while finishing some of my clinical rotations. And so like there wasn't any necessity, because I was already exposed to the field. There was no need for me to go back and train, and then come back and become a medical director or a state EP, whoever that is. It did not make sense, because you don't really necessarily use that, or you don't even like prescribe. So it's a different role. And so those are the things why a license is needed. It's needed. We need to be recognized, because we're not necessarily going to be prescribing and that kind of thing. So.
Yeah, I do share some similarities with what you did for your degree. I went to IAU College of Medicine, and also the master's program was integrated into the program as into our degree. And I remember I was in Atlanta during my rotation, and while I was going through my MBA, and the accountant left the surgical center, and then they brought up a consultant and we connected. And ever since, actually, I did some work while I was doing my rotations. I was getting paid. So I'm always interested in business. My parents are very entrepreneurial. They currently reside in Naples, Florida. I've always been exposed to trying to find other avenues. So always don't just rely on just one thing. Always try to have a backup, just plan B, C, and even D, just in case, because changes are dynamic, and sometimes you just have to be ready. I can't recall exactly how much it cost me for the MBA and MPH, but I did have some very good scholarships from those programs. I didn't prepare for that. I don't recall, but I would be glad to take a look back and share that with all of you. So my mindset is always about business. And I don't know, maybe the way my environment was shaped when I was growing up. Um, I don't know. It's just hard to tell, but I'm um, very blessed to be, having those extra degrees, because without them, I don't know what else I would have done. Probably would be an entertainment, because I do have some background helping celebrities in Atlanta with a PR campaign. Somebody put $50,000. Yeah, mine was less than that, way less than that.
Oh, really? Which program do you mind telling everyone? Because I know.
Yeah, I did. Okay, my MBA was through Davenport University. That's the one I did.
Okay.
And the NPH was through. The NPH was in Grand Rapids, Michigan. I'm sorry. Give me 1 second. I back them up. I switch a little bit. Capella and Grand Rapids for the degrees. So Capella was for the MBA, and then
Okay.
and I'm sorry.
Sorry, I wrote that wrong. I'm trying to write it in the chat for MBA. Okay, so Capella for the MBA and Grand Rapid for the MPH, correct?
MPH. That's correct.
Okay. Um,
In mine, I was typing it up, but both my online degrees were Walden University, and that's the PhD and MPH, and I think they do have like some good. I think it's definitely under 40 for sure. But I used way more than that, right? Because I was trying to fund for my med school to do that. But yeah, so I did not use the exact amount, but I think per semester is like 2,400, um, and then you can like accelerate that accordingly. And I wanted to answer something. The MPH is amazing, especially when you have a medical degree. Um, I like infectious diseases because I just like microbiology, but there is so many things that are going on right now. So chronic diseases, so whatever, like cardiovascular, if you wanted to do that, whatever your love is, there is all those specialization that are preventative that are coming up, and they need sort of an expertise, especially with so many things going on. And there is a lot of internships right now. If you just want to get, like, while in school, you can just enroll in one department. You can join certain organizations. So, for example, I'm part of like the Council of State Territorial Epidemiologists, and through that, you can actually sort of like even get a fellowship through them, and that fellowship would actually help you even fund your MPH to finish it. And then you become something they call a state epi, which is a medical administrator. And basically what you're doing, you're doing outbreaks all over the facilities in the whatever state you're in, and you're helping. And the thing why you are critical in this situation is because in med school we learn not only microbiology, but we also have a lot of pharmacology. So whatever intervention, you just need knowledge to understand certain processes. So that's somebody asked about like what kind of jobs can you do, but you can start out with just epidemiology so that you kind of learn the data language. And when I mean by that, data analytics, right? So there is certain languages such as R, SPSS, SAS, but all of these things are not hard because you can learn them on the fly. It's just a matter of like dedication, and that's what we have as doctors in general. So, but yeah, so you can start out that way, and that you can gain that through internships, and then you're just building yourself. By the time you become a state EP or a medical director, you're just amazing. So.
Yeah, my video was frozen. I don't know if you guys had the same issue. Like,
No, it did not. My
no? Okay, maybe on my end. Yeah, I can relate to what Dr. Sanoga just mentioned. And if any of you are currently doing the MPH or MBA program, even if it's integrated into your medical school or maybe not, just take it very seriously. What I mean by that is, even when you are doing rotations, because medicine, I always say that, and even during interviews, I would tell people, hey, medicine is a business. Without understanding this business, the process of it, you can be as great of a doctor as you can be, the best clinician, and you can still be on arrears and not breaking even every on a monthly basis. And I see this even right now. Well, in the past 3 years, I've been doing work with physicians, and it's not easy out there for many physicians. And if you are doing a master's program, an MBA, for instance, and you see that they are struggling with something, always ready to offer help. Even if you go for the clinical part of it, step in and talk to, sometimes just pass and say hi to the front desk or the accountant in the clinic, but sometimes just come back and, hey, what do you do? Be interested in what they do. And I'm certain like they would be readily, sit down with you and then share what they do. And if I go back to the surgical rotation I had, that's how it all started. I started to help the accountant while I was doing a surgical rotation. She eventually left the practice, and I stepped in and to help out in a few things. And from there, and that's when my whole world about medicine and the business of medicine started. Be interested in other things, not just the clinical settings.
Yeah, and it's very similar to you too. So I was actually in my infectious disease rotation, and I was I guess infectious disease with infection preventionist, right? Because that's the structure of like the whole department. And so I looked at her. She had an MPH, and I was kind of curious in what she did on a daily basis. It was surveillance. And then, I really loved her job sort of thing. And I was like, oh my God, I have an MPH too. And I guess my attending sort of like threw me into this hospital after my rotation. And I was able to, I guess they did not have any infection prevention. So I was able to like formulate their program and everything and sort of like learn like hardcore learning without knowing. But as I said, like, as doctors, we do have the skill set of learning. Like we can just pick up anything and learn, right? So that's what your medical degree gives you. And it's not that it's not far away from patient care. There is a lot of satisfaction, right, in it because you're still helping patients, right? As you said, for you, if a clinic is not being funded well, then it's going to close and you're not going to help that community, right? As it's supposed to be. It is a business, right? And I don't know if you heard about emergency medicine situation that's going on in the country, but even me, right? Patient safety, yeah, you can do all of it, but not just patient safety, but also the employees in the community, taking care of your community is all part of it. So there is no MPH program. When I think I know what she's trying to say, programming. So programming, what I meant that's more data analyst epidemiology language. They're called data languages or APIs, right? But those are, oh, okay, yeah. So for example, when you become an epidemiologist, generally they have, for example, Walden, they used SPSS. So now most departments use SAS. So there is a lot of free learning in these softwares that you can use, especially SAS and R. R has a free complete class on YouTube, actually. So like you can join them as a student and learn them in the interim when you're studying, when you're doing whatever projects you're doing during your MPH. And that way you can say on your resume when you're done, even you can do internships with departments because they do have a lot of internships. It doesn't pay great, but it is a skill that you can obtain while you are learning, and that way you can use that to accelerate your career.
Yeah, so I'm just gonna go off of one of the questions looking for job postings. So I think when you have the dual degree, an MD and an additional master's degree, it opens more doors for higher level positions. But if you have just an MD, there are a lot of public health and research positions that you can apply for that you're eligible for just because you have an MD. So I don't have a master's degree, but I'm currently working with the CDC as a public health advisor. So that's an example. I know someone that worked within poison control within public health. And then in terms of research, if you want to go into pharmaceutical research, there are positions called medical science liaisons or physician scientists. And those don't require any additional degrees other than your MD. And you're still it's a field that's alongside clinical medicine, but you don't need a license because you're not practicing. So it's more data entry and clinical, like the clinical application may be a part of it, maybe 10% to 50% of the job, but it's more of a wide variety. You're not in a clinical setting 24/7. That's the only thing. To be in a clinical setting 24/7, that's where a license would be needed so you can treat patients and things like that. But these are more jobs you can look and careers that complement clinical medicine and work alongside clinical medicine. So you may still have a lot of the things in that in your career that you really love about medicine, but it's not, you don't have to do, the thing is you won't have to go the clinical route to achieve that. So I see, thank you everyone for posting the resources such as the Pro Fellow and see the SAS trainings. I will try and create a document to send this later to everyone that's attended. So do you have, either of you have anything more you'd like to add regarding your route, or would you like to answer some of the questions that are coming up?
I could try to answer some. I think when it comes to job searching, and I think one of the website is called Unmatched MD, but I think this website is gonna kind of because probably she matched the person who was.
No, she has. That person hasn't. But
Really?
they're still, the website is still active. It's just
Not updated.
It is updated for a good amount of things, but they're running it all by themselves. So it's based on their free time. So they don't have a lot of support. I work closely with Unmatched MD.
Yeah,
so
I feel like we should partner.
Yeah, a lot of these resources you have, like Unmatched MD, Inside the Match, American Society of Physicians, Alliance of Medical Graduates. These are mostly unmatched medical graduates that are doing everything in their free time. So, you know, you're looking for just what we are also looking for, jobs and working regular jobs outside of this, doing other things, and even applying for match. Right. So we're trying our best to get, you know, all these resources in one place so it's accessible. It's just we don't have 100 people working on it that are paid 9 to 5 to do this. We're all doing this on our free time. We had the same question come up for assistant physician licenses, how to find jobs for that. These are things in the works. But in terms of job, like I literally just typed in public health on Indeed and LinkedIn, and that's how I found my current position. Sometimes that helps. Medical science liaison for research. If you type that out on Indeed or LinkedIn or even Glassdoor, there are a lot of pharmaceutical companies that are looking for people like MDs that can work within that role. Sometimes it's a connection at your own hospital. Like I was working as a research coordinator, which is an entry-level position before, and everything else was like I was just doing research within the clinic, and they were trying to recruit me into the pharmaceutical company because they saw I had an MD and I could work within that. So job searching, you have to find the resources, but it's great to just Google or Indeed or LinkedIn, and then now you have resources. So Priyanka asked about links. A lot of these are already on our ASP resources page, so you can see a lot of those postings. Once we get more postings for jobs, you can find, we'll have more information on that. And Dr. Sainval, I know you wanted to add something.
Yeah, just to add to that, I'm sorry, see, our name is Senoga and Sainval. It sounds almost the same. I'm sorry if I jump ahead. I apologize.
No, go ahead, Sainval. I was saying Dr. Sainval because I see you wanted to say something.
Okay, here, yes. So with job search, you know, first of all, look at your resume. Look what's in it. And sometimes, you know, when nowadays big corporations, they receive tons of CVs, you know, inquiries every day. So you have to set yourself apart. And sometimes it's AI doing all the search, scanning those CVs, and then they match with whatever criteria they're looking at, and then they score you. And then that's if you the same with the match. If you have one program receiving 1,200 applicants, eventually they have to stop adding the filter. That is exactly the same thing that corporate America they do. And what
The
I've
difference
been
is the
saying,
applications are free outside of math.
that is
You can
correct.
apply almost.
Exactly. That's
If
great.
you meet one criteria or you're not eligible, you can still apply and you'll lose nothing.
Exactly. Hey, thanks for clarifying that.
Yeah.
So, what I would advise people to do, what I normally do when I apply for a position is look at the description and the requirements, and then go back to your CV. And if you apply for this particular job, and pick up those keywords they have in there, like experience and skills and the different skills, and then add those keywords into your CV, because when the machine start looking for words, and yours will come and score higher. And that's what now I don't have a supervisor right now. However, he said, dude, yo, we're just having fun now. We become very good friends, and it's like family. He said my resume was pretty, my CV was just right on. And that's why they call me out of like 100 piles they had in there, and they were pressing for time. And it's like, look at yours, and I call you. I was at Publix in Rome, Georgia, when I got the call. Hey man, you have some free time? So yeah, I'm at the cash register right now. Can I call you in about 2 minutes? I said, no, but we need you for an interview today. And then lo and behold, ever since it's been a mystery. And just look for keywords. Look at that, and also rewrite your resume. And for instance, I work for WellMed. WellMed is part of United Health Group, and also Optum, right? Um, you may look for other positions like Aetna or Kaiser. They may have the same job, but they use different words. They're looking for different things. So maybe for each one of these, if you want to apply, we'll just change the keywords so you can score higher. I don't know if this helps.
No, I want to echo that. That's
Mhm.
what it is. Don't twist it. Don't try to even say this like that's applies to the government jobs, right? So
Mhm.
they do use AI. So AI is like something I feel like employers actually they keep saying we don't have anybody to apply, right? But it's your
Mhm.
AI literally filtering out all your applicants. But don't try to even twist it, make yourself look amazing. If it means even copying and pasting, literally, I would do that. So, because all you want is a chance to be interviewed,
Mhm.
and similar to even the match, there is an algorithm to this, so
Yeah.
how you can.
But they're very I want to add, they're pretty transparent about what they're looking for.
Yes.
If you look through the job, any application or any site that has a job posting, they'll list out your eligibility and how to, like, what counts as eligibility. Like sometimes I've seen places where they'll say an MPH or 3 years of equivalent experience.
Yes.
And as MDs, you have public health experience to a degree within your education. So it's really about applying your experience to what they're looking for. I got into research having no research background when I first, and same with this. My currently working with the CDC. I work with MPHs. I'm one of the only few people that does not have an MPH. So it's really about, they want to see if you have experience that aligns with what they're already doing, and you do have it to some degree. And then whatever you don't have, you can always write you're willing to learn and explain that in a cover letter, how you've adapted or added to your skills that you necessarily didn't learn through your degree, through other jobs. And that's what's really great about this, is that they're not trying to, you're just telling them I'm qualified. That's all you have to tell them. And if they see that and the AI you get into that algorithm, you probably will have many, many interviews and many job offers. So
and they do need you. Like,
yeah.
you can do this job. It's not like you can't do it. right? Because they're going to train you. The whole onboarding process, you will pick up, like you've gone to rotations, like you've never been like surgery, right? You've never seen an OR and immediately you adapt, right? So you will adapt. So don't think, oh my goodness, I cannot do this. Don't be intimidated. It's a matter of will and doing, which you all do have. And it's amazing. Like some people think medicine is the only thing I'm going to suffer if I don't get into residency. But that is what we're fighting for together as a group, so that when you have an MD, you are recognized. We don't have to sort of be in this limbo where we're not recognized, and we're very highly intelligent people who can run these programs, right? And now PAs and NPs are, and I'm not discrediting them, but there is like a difference even within physicians, sort of like I've had experience, okay, with NPs, right? So where we don't do our differential diagnosis the same way. So like they will leave out a lot of things that are so critical, right? You're looking at risk factors and about this patient that they were looking at, and we just have a different approach because of our training. So we need to be in these jobs. They don't need to sort of take over, and our license need to be recognized that we are credible. They go to school 3 years, we go to school 4 years, right? So or more. So we need to be in these positions, and we're gonna fight this till we get it or we're recognized.
Yeah, I agree. And unfortunately, the reality is 25% of applicants will not get into residency. And it's not a sustainable process to continue applying for residency, and you need money for it. So that was the purpose of this webinar, is to open those doors, either to find a career or a career that will get you LORs as well and pay you enough to, pay your bills and even pay again for the mat. Like I was fortunate enough with like working with research, now public health. These are well-paying jobs. They are not minimum wage. You're making at least $30 or higher, depending on whether it's this is $30 an hour plus benefits. It's not like you're working overtime all the time, like when you're on rotations that you might stay longer. When you clock in at a certain time and you clock out, you have time to do other things. And you can build connections if you're working in a hospital setting. So if this is like a stepping stone for residency for you, it's a way to impress doctors you're working with, or even work. I know several people that worked as clinical research coordinators at a hospital that they have now matched at. So these opportunities work both ways, either as a entry level for a career path or as a way to stay within clinical medicine, or at least adjacent to it, so you can get continue to be seen and noticed and get into residency.
And I'm gonna actually say something that is so in public health as a consultant. Consulting has a lot of money, by the way. So because you're not going straight for a job. Like people make 85, 100, 150 an hour, right? So I'll be transparent, 85 an hour, right? So, but yeah, it is something I don't really need to go to residency to be happy. I really don't, because, I do make that 6-figure, right? So, what I'm trying to say, it's residence is not all. So we need to sort of like fight this and make sure that we're recognized.
And just to add to what both of you have just said is, why do I get into this and trying to post? And right now, I can say that, I can resonate in the 6-figure aspect of things. That's where I am, and probably even make more than a doctor when you account for because I have a lot of other skills out of medicine. For instance, I did a lot of marketing for celebrities in Atlanta, and also I was a visual creating content director for a big firm in Europe. They were paying me €1,000 every day for work. you know. And at one point, my wife said, "Hey, man, you might need to scale back because you're gonna leave medicine behind." And she knows exactly where my heart was. And she said, "You need to stop working for these companies and get back to what your true passion is." And that's, when I decided to enter corporate America. See, there's a lot of things that you can do. Not everybody is the same spot. I remember I was doing my rotations. There was one of our colleagues doing her rotations, and she was pretty much, well, going to that clinic almost like in a volunteering, um, deal. And then she was worried about how she was gonna make it home because she didn't have gas. You see, and she was a medical graduate, and I could feel that she was being taken advantage of in that situation. And I said, you know what, you need to get out and find something that will pay you, because it's hard out there to be living, and you can see the commitment. And she was driving like an hour from Atlanta into rural Georgia for the rotation, and sometimes she had to sleep in her car because gas would not make it back home and to come back. And whenever I think about these different scenarios, because medicine is very brutal, the culture is very toxic. You have to own yourself, and then within each one of us, we have our own talents, skills, whatever it is. Sometimes we may think that, I'm not saying that do not pursue your dream of residency. We should all enjoy it. But at least as you do so, they keep selling us, hey, work on research, free research. Hey, come and do free rotations here and there. But who's going to take care of your bill? How do you learn when you can pay your bill, when you can afford gas? I am against this work for free thing, completely against it. I normally would tell people, hey, find yourself a job Monday through Friday so you can afford to volunteer on weekends, maybe on some afternoons. So right now, I can do whatever I want to because my job is very flexible. Now I'm salaried, I'm not hourly, so I can go in, do whatever I want to, so long I get shit done. That's what they said. You get shit done and you're good. And when I started, I'll be brief. Sorry, I take a little time. I applied for the CQA positions. Ever since, they've created a new position for me, because when I started, I said, you know what, they want to be sure that I wasn't going to apply for residency, but they played the game, because it's not that they're not against that, but they want to see how the commitment. So when I said, you know what, I said, I don't have any plan right now to apply for the next 2 to 3 years, because I do want to get dealt into leadership, because I have all the aspirations. And the medical director in the interview. He asked me, "Hey, dude, but you have this Missouri license. You could work as a assistant physician in Missouri." I said, "Yes, but I just have it just in case I have different things to fall onto just in case if this doesn't work." And lo and behold, I got into the job in last July, and November and December, he pulled me through. He said, "You know what? We took a bet on you, but you've won our heart, and we're gonna create a position for you. Now you're gonna work in my office. So everybody, the NPs, the other doctors, they report to me, and I report to the medical director's office." And he said, "Listen to me. If you want to, are you applying this year?" So he still asked me, did you apply this year?" I said, "No, I did not apply." But he said, "Listen to me." That's how he talked to me. That's how we talk to each other. "Hey, man, if you want to go to residency in the next 2 or 3 years, just let me know. I'll make a phone call. But if you really want to get in there and become a leader, and he said, I used to be a FQHC director. I will make you become whatever you want because you were honest. Just be true to yourself. Tell them your short-term goals and be prepared to answer short-term goals and long-term goals. No, go from limit the short term to 2 years, maybe the long one about 5 years, somewhere in between to have a buffer."
I do agree. Yes. Because this takes time. Whatever you're pursuing takes time, right? So through 2, 3 years, 3 to 5 years, maybe 5 years you don't want, because most schools, actually, one of the program director was like, don't go more than 3 years. He's looking out for me. He's making sure I don't overdo it. But this is the struggle I've had. I'm like, because I'm trying to pursue the state epidemiology one, right? But it does require a temporary license. So, and right now it's temporary. It's going to expire. So but he was like, don't go over 3 years, you know? So that is the struggle I'm going through. But I really, really love what I do, right? I do love it. Like if I just ended this way, it would be fine. But then again, I also want to be recognized in my field that I am a physician too, right? And I have knowledge, right? Because there is this misconception: if you don't go to residency, you don't have knowledge, you don't know how to practice medicine. When it's actually the opposite, because you know a little bit of everything, right? And so like, and all those things are not that hard. You can go to these. So this is the way I'm going to tell you exactly how I do it, but you can go to these evidence-based practices and see, okay, this is what the ID doc is going to sort of like prescribe and what dose. And so now I'm going to kind of tailor my, let's say antimicrobial stewardship program and sort of like be an administrator and kind of be like a surveillance person, making sure that there is no resistance going on. But it's not hard. That's what I'm trying to say. Like, I don't even understand how you have to go through ID fellowship and then get this position. Like, it doesn't make sense. But
yeah, and I think the comment we just had saying that you don't have to be linear in our thinking. That's actually very true. So there is one physician who was unable to join us. His name is Dr. Amiad Friedman. I will put in his email address in there, but he is a U.S. medical graduate, and he did not apply for residency, and now has his own digital health company. And so what they do is he likes video games, and so he uses video games, his passion for video games and medicine, to use it as a tool to promote health. So I'm going to put his email and name in there. He was unfortunately not able to join us today, but he is also really interested in how to promote health, but in a, adjacent to clinical medicine. So feel free to reach out to him if you have any questions about what he does. He's also active on Twitter, and he said he'd be willing to connect on LinkedIn as well. So really, once you stop looking through the lens of only residency, you realize there's a lot of other doors you can go through. And it's determining whether residency is the pathway to achieve your career goals, or if you can do it another way. And I think a lot of people will be happier where they are, rather than desperately trying for anything, just to get into residency, because I've been there, I have done that, and it's not the right way. You have a degree that's very useful. The assistant physician license is one thing that we discussed last week. You can also see more of our that webinar. It's posted on the website as well as on YouTube. But that right now is not a pathway necessarily, but it is a great experience for those of you looking for clinical experience. Today's focus was on, since these licenses aren't federally recognized, really, I think my video cut off right. Okay, can you all hear me?
Yes, we
Okay.
can.
So what I was saying is that these are opportunities that you will be unlicensed, but still adjacent to clinical medicine, or get you to a pathway within medicine, like within administration, or you could be working in the suite of a hospital, because a practicing physician can't most of the time. They can't even own their own hospital right now. So a lot of these are new opportunities for us, and so many of us are pigeonholed into thinking residency is the only way. And we shouldn't be thinking that way. I think that's what's very important is your degree is extremely valuable and can be utilized in many different ways. It's up to you to see what is the best for you.
And to sort of like piggyback on that linear thinking. So one thing I have seen what works is, associations, right? like nursing, they always have this correlation. So you kind of mentioned an important statistics of 25% not being able to match. So to what extent are we going to sort of like let those 25% go through the cracks, you know? So if we form a coalition and kind of demand that we are recognized, just like nurses do it, just like nurse practitioners do it. And the latest one was the physician assistant. Now they're called physician associate. Okay. Just kidding. But, you know, they just did not want to be called physician assistants. So they formed a coalition and they said, we want to replace that as physician associate. That was huge in the emergency department because PAs are generally in the ED. So the ED physicians were like, no, we don't want to call their physician assistants. That's what it is. And they just wanted some sort of recognition because there are times when they are literally taking charge of the, you know, the ED. So they just wanted that recognition, and they got it at a federal level. So there is no point. We cannot get this recognition, especially with so many people trying to increase these, you know, spots. In the interim, we can sort of make this stand, especially if they have already started that process. Why is it temporary for 6 months? Why can it be ongoing? So. And then we cannot hear you, actually. We cannot hear you.
Sorry. I was
Okay.
saying, there's a comment saying epidemiology could definitely prepare for a future preventative medicine residency. It's just the matter of getting into a prelim before you can even get into the preventative medicine residency. That's usually PGY2 or above. So still, like, yes, it would prepare you, but at the same time, it's not a guarantee. I mean, as you can see with Dr. Sanoga, her extensive experience in public health and epidemiology, she should be done with residency, but it actually doesn't guarantee that you will. So because there's too many, the numbers are against you in terms of that. But yes, hopefully one day it will help in terms of that. But I think it's about being realistic. Like, can you keep pursuing residency, or is a career outside of residency more fruitful?
And so, like, to sort of like talk about with Henna, like, I think we're working on some few things. We're gonna work on that. So the way residency works is funding is coming from Medicaid, but there is alternative ways of funding too, such as HRSA, the one that I sent you, and I do actually. So that's what public health is amazing. I have an ability to write grants, not only write grants, but to create and also sort of lobby into leadership, you know, the AMA and everything. So that HRSA one, I am going to push, but, you know, creating these spaces, like I do see need, like, you know, there is that will that some people really want. And I don't feel like people should feel that way, you know, like feel like they're lacking, you know, going into residency. So if we can sort of also, you know, if they know people to create these jobs, you know, especially in rural health disparities where, you know, they need care. And if that's something we can work on together, I think, you know, moving forward, I am going to pursue it. I know it was deadline today, but I think I will talk to the person and see if this can be created more, because there is money there. There is lots of money there that can help out a lot.
Yeah, sure, definitely. All right.
Yes. Hello?
Sorry, go ahead.
Yeah. So sorry, I'm having a lot of all type of technical difficulties here, but bear with me. I've been in and out, and I do believe that we are going to define, or we must define the future of our current situation.
No, I think he froze.
Sorry, doctor. That has been a struggle for
That's all.
everyone.
I think it's maybe the platform as well.
Okay.
But hopefully once he's back on, we'll have him.
How did you find this platform, by the way? I'm just kind of curious.
I can connect you with our president, Mohammed, and he can tell you how he found this platform instead of others.
Okay.
Yeah. Sorry, we
guys.
cut off. You can start over.
So what I was saying is we have to define our position because I just got back from the Beyond Flexner conference and I interacted. The THCGME folks were there. First, they had the CEOs. They had a lot of great information and ACGME is powerful. And I interacted with those folks in the AMA, and I'm telling you, they do not want to change the current system, and they just want to build upon what's failing. And that's why I said medicine is so dysfunctional because if something doesn't work, you just have to re-strategize and bring solutions. And I said that's what I do. I had the opportunity to ask so many questions. And one thing for Arizona, and for those of you who have the training license, many doctors in Arizona don't even know if there is a bill which permits medical grads to work in Arizona. But I was able to, yeah. So what I'm hoping is that all of us come together and then and make some loud voices because and also educate, be ready to have a strategy to educate because I'll tell you 98% of the doctors I talked to in Arizona, they did not know there is a bill, a training license bill. All they kept saying, I have so many emails, I have emails like all over the place here of people I'm going to follow up with. They said, please send us some more info, send us that bill so we can learn about it. So imagine if we were calling those doctors, those clinics, and then ask them for opportunities. We had a dedicated office calling and just, sometimes I remember when I was sitting for the MCAT at USF, I did some training. I called 6, 7 doctors. Nobody answered, but the 60th one opened all the doors for me. So we need to keep calling and calling so we can educate people about who we are, that we are here, so that they know about us. Most people do not know about us. Okay, that's the one. And also one thing I'm doing here, for those of you who are interested in jobs and outside of the clinical setting, which is in healthcare, I am putting a document together of buzzwords to use and some strategies. It's gonna take me a little bit.
Oh no. But I know what he's trying to say. So he's gonna bring back a document together to help you so that when you have a little bit of money and you're not starving, like you kind of think clearly. You think, okay, I am worth it.
Yeah.
So I am gonna.
You're not in that desperate situation.
Yes. So we need you to get those jobs right first, and then we're strategizing here, right? And then we are going to be loud because you cannot be loud when you're starving. You kind of like have to sort of like
do some ATPs.
As I am. I don't care, Spike. No, anybody. I know there's like future psychiatrists in the group, but you can take psych, neurosurgery.
Yeah, so that's why. That's exactly true. That's why we did a assistant physician webinar last week, and then this webinar this week, is because these opportunities are out there, but no one knows about it. And if we get 1,000 people to get a license in Arizona, and 1,000 people are questioning and asking for jobs for that license, someone will take notice. That's what happened with the assistant physician license in Missouri. It's been there for 4 years now. And just now it's taking off because now more people are applying for it and utilizing it. And I didn't even realize, within my position, I've met 2 other MDs that are actually not applying for residency, that are going to work within the CDC, that are finding these job opportunities, and they were in a much happier place than I was when I was applying for residency, because they found their path, their career path. And it's exactly what Dr. Sanoga is saying, and Dr. Sainval had said before he got cut off. But
I'm so sorry. I don't know. I don't know what to say. I don't know
No,
exactly what I was cut off. I kept talking, and I thought you guys were paying so much attention to me. I was like, oh,
all the
shoot,
technical
I
issues.
was cut off again.
We're here to provide whatever resources we can, but no, it's going to take more work on your end to get there. We can provide as much resource as we can, but we're also going through it with you. So, but be persistent. You'll find something, and then stay in touch with these groups like American Society of Physicians, Alliance of Medical Graduates, which Dr. Sainval is a board member of. And then Dr. Sanoga just actually joined, like I connected her through Twitter. There is a group of us and a community of us, and we're all working together. And we need to stop struggling. There are ways you don't need to struggle in your position. You have an MD, and that is a very coveted degree. It's not, you shouldn't feel you can't get a career out of it. And the only way to do that is residency, and then you get rejected by residency and you feel you failed. You have not failed. I say this all the time. The system is failing us, but it's now time for us to be innovative in how we pursue our degrees and our career pathways. And hopefully one day it'll be that no matter what you do, everyone gets a residency, but if you don't want to, you don't have to pursue that pathway and it's an option. It's not the end all be all that a lot of us think of at times.
Because some people actually drop out.
Yeah.
Right?
No, and they're physicians that end up doing residency and then don't even use their clinical experience for anything. They're in a field that doesn't even require residency. Or they could have done without residency. So I know several.
One thing I want to sort of like address here, like I see so many people going, I'm interested in sonography, nursing, and MPH program. So I don't like the whole sonography and nursing. It's like, you're an MD. Your knowledge skill set being a nurse at this point is going to kind of like do you a disjustice. I know you really want to be in the medical field, but that necessarily doesn't help you.
But if you want that now, that's the assistant physician license. You don't need to.
So that's what we're trying to push, the assistant physician, so that you don't have to do sonography, nursing, MPH program. If you don't want to, because not everybody wants to be an epidemiologist too. You know, I love it. I just love public health, right? I mean, my environment. So this works for me. But I don't think I would ever go back and do nursing. Why would I do that, right?
I agree.
Yes,
and the thing is,
don't do that.
When you go to I hope I'm not frozen again.
No,
you're fine. Oh shoot, I spoke too soon.
We jinxed it. But no, don't. I mean, I guess if you want to do that, but that's the whole point we're doing, the assistant physician, so that you don't have to pursue surgical assistant, sonography. I've heard nursing, and I've heard of people even doing medical assistant. I'm like, oh my goodness. Wow.
Like you've already worked very hard for your degree. You should be able to utilize it. You shouldn't have to go back to school unless it's like an MPH or an MBA that's complementing what you're doing and just going to open more doors. So the AP route, it's for anyone that's completed up to step 2. There's no way you can get a license in the U.S. without completing USMLEs. That's standard because that is our licensing exam.
And that's CFMG. You have to be CFMG certified.
Yes, as well.
CFMG certification. After that, you can apply for the Federal State Medical Board, which that's the one that you take step 3. Once you're in that FSMB situation, try to take step 3 out of the way because that's what's going to even enhance your application moving forward. They want to see a completed step 3. But not only the FSMB is good, then you can also join associations. So like under the American Medical Association, the IMG, there's an IMG section. So the importance of having this is that you lobby, so our voices are heard. So what we discuss here wouldn't have an impact until we go to government, because that's the one that funds, residency.
Right.
And so we need to be among the AMA IMG, which I am part of. Like, I'm part of like different sectors already, right? So, but I do have access to that because of that. But all the other agencies always like look out. It's not for only like, I guess moving forward, we can also sort of like work together on expanding these things. Like, if you find money, we all work together. Like, if I find it and I don't have time to work on it, somebody else can work on it.
Yeah.
So
and I think something very important just brought up. A lot of what we're saying, yes, only applies to some U.S. citizens and permanent legal residents, but you have to have work authorization already in the U.S. There aren't a lot of jobs that sponsor visas because there's no need really to go outside of the pool of applicants within the U.S. And then within U.S. IMGs and even medical graduates, we have people that have immigrated. Like I am born and raised here in the U.S. and went abroad for med school, but we have a lot of MDs that have immigrated into the U.S. and then not gotten into residency here and practice maybe in another country that end up doing another route. So yes, a lot of the things we are saying is appealing to that group because the visa system in the U.S., I don't even want to touch it. It's so complex.
Leave it alone.
Yeah. So if you are someone that needs the visa thing, we at American Society of Physicians are not, we are not supporting that in any way because it's just too complex. We will provide the resources for getting jobs and residency, but in terms of visa, that is on an individual basis, and the individual applicant will have to pursue themselves. So yes, I did want to clarify that. Thank you for whoever brought that up.
Yeah, and so I know like some AP licenses though, they do, I think accept the visa maybe? I don't know, because I think the Illinois one does.
So I think it depends if they ask for whether they ask for a social security number or if you're already authorized to work. The Illinois IMG one does not ask either of those. So that's why you can get that. But it doesn't mean you'll get a job because they're going to want someone that's here in the U.S. to help within the clinic, not someone who have to go through the whole visa process.
Right.
So the visa situation, like it's so hard to go through it. That's why ECFMG was made to assist with the international graduates for those that need visas versus not. And a lot of jobs also, they don't want to handle it because it costs a lot to go through that paperwork.
And they simply don't know. When people don't know, they just don't want to try. It's just human, psychology. They're like, oh, that's too complex. And then, then you even add in a factor of like, some sort of nationalism. So
I know people that have applied for the similar jobs here, but they've gone over through the visa thing themselves, the job themselves, where the company or organization they applied for the job did not assist in that. They did it all on their own, and then if there was any paperwork they needed to sign, they did it themselves at the end with the organization. The organization didn't sponsor them themselves.
And
I know there are jobs, but
one thing I would add is usually the larger institution, academic establishment, they have a much larger bandwidth to accommodate because they have an entire legal department. Because once you get into immigration, myself, I was born in Haiti. I came here 16, and I've been a U.S. citizen for a little while now. And I have the members. They go in and out of the system, and usually, check those large institutions because because I've had people reaching out to me and ask me about visa sponsored programs. I don't know much about them, but what I'm doing right now is going to do some research and be able to link them into some research opportunities, because usually those larger, even the CDC, they may have a section, even if it's, it's a US government type of
So
program, they
actually,
do have
they
visa.
have certain jobs, and they're
Exactly.
located outside of the country though.
Exactly.
So they won't be in the U.S. If
Oh,
you're like the CDC, actually, we had a couple of people that were on visa, and
mhm.
one didn't do the right paperwork, and they realized that they couldn't be because for any of these government jobs, you have to be a U.S. citizen or permanent legal
Clear.
resident.
Yes.
We don't take any visa status.
It's very
they will,
complex.
but they do
So
have.
like,
But they
especially
do have public health like associations outside of the country where you can go to Cameroon and work and still be under the CDC, or you can go
Exactly.
to so it wouldn't, but those positions wouldn't be in the U.S. That's I think one of the stipulation about it.
Yeah, because it depends on what kind of clearance. There is also
Yeah.
clear, right?
Yeah.
So like
Background check. Yeah.
GS 12 and above,
Yeah.
you have to go to a third level, like where they're even looking at your grandparents, right?
Yeah.
To be cleared because of certain information, right?
Yeah. So a lot of people,
information.
that were not born in the U.S., their background check actually took longer because they had to go to those countries where they were born.
Mine too. So I wasn't born in the U.S. Just moved here in high school at 15. So so that took longer for me, to be cleared. It literally took 3 months, right? So
yeah, and mine took 1 week because I'm born and raised here. And my parents and grandparents were all citizens. So even though they were immigrants, they were citizens. So it was easier for them.
Nice.
So that is a difficulty for a lot of these jobs. But if you can find a way to immigrate or get a visa into the country, then they would be open to you. It's just it's a case by case basis. You have to look at the job you're applying to in the organization.
Yours took a year because you look where? Because you lived abroad. Oh yeah, so they had to like dig through all of that. Yeah. Oh, that's just awful. Yeah, I guess. Oh my God.
So it's definitely depending on the situation.
Yeah, I guess. I was thinking mine was long because, I guess my boss, I was, at that time, my boss was like, oh my God, it's not yet here. And I'm like, I don't know what to do. Like, what do you have? And I'm like, nothing. It's just, I guess it's a crime not being born here.
Yeah, they do. They really, I have studied abroad and everything. They checked all of that too. Yes. So it's not, they check every little thing when it comes to these government jobs. Yes, the SF-86 investigation. So I don't want to go too over, but if you guys have any final comments, and then we'll close up. And if you'd like to share your contact info, if anybody would like to reach out to you, can do so in the chat.
Sure, I'll do so. One thing, I don't know if you guys heard right before we got caught up a few minutes ago, I was talking about trying to work on a document about an outline which will direct you on how to look for non-clinical jobs. It's taking me a bit longer because I've been busy doing some other stuff, but it's coming. There are some like when you go to Google, just going to Google and not knowing what you're looking for, it's kind of hard. But I've had days when I just call different jobs and ask, do you hire medical graduates without residency? And I've been doing that my free time, just to reach out for other people.
Oh.
And this is the right thing to do.
Yeah.
So I'm compiling a list of, I still have, oh man, sorry, I got sorry guys, a whole lot of mercy. This is not a, and this is the first time this has gone so bad.
That's okay.
Too much fighting. But I'm preparing a list of words you can just type in there, because Go Live EMR, these folks they pay like $40 an hour, $40+ an hour, so you can help older docs in certain areas of the country with EMR, because hey, older docs, they first, hey, where's the pen? Give me a pen, not just where's the mouse and keyboard trying to hit buttons. They don't like that.
Yeah,
so
there are several companies that will hire you.
So we work with multiple EMRs, along our training. So what, you know, even if you don't remember what you did, just put it in there, and you can easily, you know, once you are trained, you can easily grasp that concept, and then be out there, and then get going from day one. And also, if you there are some keywords in public health you need to know about. So if you're going to apply for a job in healthcare quality, you have to know about HIDIS. You have to know some vocabularies that pertain to that particular job or field that you're interested in. So I'm going to put all of this together for you. Population
If you
health.
need, if you need infection
Mhm.
prevention, I can help you with that.
There you go. So maybe we can work on a guide.
Yeah,
Because
yeah,
the thing is, I hate to see when people are struggling, and
no,
and
Yeah.
and when you should not struggle, and
you
it
should not,
bothers the hell out of me.
please.
And we should not be after 4 years of hard work and labor, and then, you know, the establishment just don't get it. They do well
You are
whenever they
so
see you.
valuable, so
Yeah,
valuable. You're a million. Like, if you're feeling so down right now, I want to
mhm,
uplift you and just show
exactly.
you value, how
And it's
amazing
okay.
you are. And to get
Yeah,
even here is just amazing. You've done a
it
great
is.
accomplishment. So,
So we'll follow up. I'll type my info in the chat room, and also, like, if you guys go to at a job, there's a few things. Not just applying for a job. Learn how to negotiate up your salaries.
yes.
Don't just fall for what they want to offer you. Okay,
Mhm.
tell them, hey, I have an MD. This is where I am, and this is what I can offer. This is what I always tell people is that, hey, medicine needs me more than I need medicine at the moment. Even if it's not the case, just put this in your mind. And I always say that if you don't define your worth, somebody else will
Will.
define it for you.
That's right. That's
So know
right.
your worth. Know your worth. Know your worth. None of us should be working less than, I believe, less than $65.
Yes.
I mean, $65,000 a year. I mean, I'm talking about residency about 45, 55, etc. But none of us should be at that level.
Hmm.
Residency type of labor is a different story. I would not go
Yes.
into it right now.
Yeah.
That's
But no,
another
and also
helpful
like
figure.
that
Hmm.
that negotiating thing is
Hmm.
so true. Like I had to learn that the hard way. Now what I say, I am a doctor, and it's actually illegal to pay doctors less than 100.
Yeah.
Uh, in general, like that's
Yeah.
actually that you just have to know what state you're in.
Mhm.
That, like in Illinois, it's kind of illegal for HR. Like, you need to know HR codes too, right? It's illegal to pay doctors less than 100 grand. So know your worth. You are a
Mhm.
doctor.
You
Okay.
are.
So
Don't
like,
let anybody put you less. No, no.
yeah. So
Yeah.
at first I was like, when they were giving me that price, I was so desperate. I was like, on the first try, I was like, okay, okay. But now I'm like, negotiate, say, even like I did not even know like consultants make this much money too, right? So I am learning this. Like, I am getting on the lower end of consulting. Just FYI. I think I'm making something, but I'm not, apparently.
Sure.
So just know your worth. You're worth it. You are smart, and you can learn these things. Even if you don't learn them, fake it till you make it.
All right.
Because
Sorry,
that's
did you have
true.
something more to say?
Yeah. Yeah.
That's good.
Sorry, I don't want to keep everyone too long.
Mhm.
But if you have any, you two are okay if I tag you on Twitter, your ASP account, so that if anybody wanted to follow up through social media.
That's fine. No,
Yep.
absolutely. So
Okay.
we are here to help one another, and
Yeah.
whatever it takes, you know.
Yes.
Don't be afraid, guys. Reach out
All
anytime.
right.
I'm gonna put my phone number actually in there.
All right. Thank you, everyone that attended, and thank you especially to Dr. Sanoga and Dr. Sainval for taking time out to speak about this and encouraging all the unmatched physicians out there and how to develop their careers. Really, that's what we're here for. So that's it. If anyone has any questions, you can reach out to us at info@asphysicians.com, .org, sorry. And I will also post information on the other groups and more information on how to pursue these career paths. All right. Thank you, everyone.
Okay, thank
Sorry
you
for
so
my
much.
technical
And
difficulties.
there goes, yeah. Thank you.